Chapter 20 Integrative Medicine and Health Research Methods, Case Studies and Research Priorities. Krishnamurthy Jayana, Kangat Haran G. Sai Babar M. Abstract. Integrative medicine research refers to a systematic and scientific integration of the modern and traditional systems of medicine to achieve best possible outcomes of health and well-being for the clients. Lack of adequate communication between the disciplines, lack of clarity in execution of integrated protocols has affected research and clinical practice. IMR aims to effectively integrate subjective and the objective dimensions of health and well-being to enhance quality of life. This is particularly relevant in today's scenario where interventions that lead to increase in longevity of life are not necessarily improving quality of life and well-being. The current chapter targets the medical education fraternity from modern and traditional medicine backgrounds and provides clarity, direction, and practical guidance in planning and conducting IMR. The chapter also provides case studies and best practices in the space of Ayurveda research, and finally sheds light on relevance of appropriate communication and knowledge translation in this space. The authors conclude that the successful conduct of IMR requires conducive ecosystem, coming together of multidisciplinary experts jointly led by the clinicians from modern and traditional systems with the backing of a clear vision, roadmap, and funding. Research methods can vary from simple exploration to observational studies to experimental trials within hospitals to observe clinical impact, as well as health systems and public health research to observe population-level impact. Often the research methods and instruments in one discipline may not be applicable to other disciplines, which should be duly considered. Appropriate attention to ethical considerations and consent procedures while conducting research and systematized knowledge translation with the stakeholders will go a long way in strengthening IMR. Key words: integrative health, complementary and alternative medicine, integrative medicine, research methods, research priorities, assess need. Integrative medicine, complementary and alternative medicine are the terms used interchangeably in relation to how traditional systems of medicine relate to mainstream or conventional medicine. Lack of clarity of these terms among the stakeholders and the community has hindered research on the ground and policy formulation, particularly in basic sciences. Some work in this direction is already going on and outcomes are awaited with bated breath. For instance, the ASIIA Science Initiative in Ayurveda. While the need for more options to promote holistic health and well-being are clearly felt by both care providers and the public, and is also well articulated in the policies. The no-do gap, inadequate capacities and systems to carry out multidisciplinary and integrative medicine research have affected progress in research and knowledge uptake. This was witnessed most recently in the COVID-19 pandemic context. Over the last 150 years, the average lifespan of population globally has increased from under 30 years to over 70 years. The most common killers then used to be communicable diseases, which are now replaced by the non-communicable diseases. Despite advances in clinical and public health infrastructure in the space of modern medicine, that have led to this transition and improvements in longevity. The quality of life and well-being continues to be suboptimal, with a large number of people living with chronic diseases that can adversely affect their quality of life. The aim of the present paper is to study quality of life and especially health-related quality of life HRQOL. The non-communicable diseases are characterized by lifestyle changes, chronic nature of medical conditions, which at best can be controlled and managed, but not cured, require constant attention to health behaviors, risk factors, and treatment compliance, which put people to a lot of stress and anxiety, affecting their well-being and quality of life. Sustainable Development Goal 3 refers to both health and well-being, but modern medicine has challenges in addressing the well-being and quality of life which have personal and subjective connotations. This aspect of subjectivity also poses a challenge for research and clinical practice in this space. In the recent years, complementary medicine research and integrative medicine research are emerging as solutions to explore how the conventional and non-conventional systems of medicine may come together to address both the objective and subjective measures of health and well-being. Alternate approaches, when integrated scientifically with modern medicine, can not only promote holistic health and well-being but can also be cost-effective and preventative in nature, thus offering many benefits at individual and public health level. India has been the home of traditional systems of healing such as Ayurveda, yoga, and others which are increasingly researched in the past few decades. The current policy environment, both globally and locally, is more favorable for multidisciplinary research in the space of integrative medicine. However, the research capacities to conduct integrative medicine research and the institutional mechanisms and training systems to support clinicians and researchers are not quite there to fill this growing void. Efforts are proactively undertaken globally to address this gap. Medical education systems, both in the schools of modern medicine as well as AYUSH, need to be strengthened in this direction. In this backdrop, the current chapter is written to keep the target audience as faculty and postgraduates of allopathy, AYUSH, and other health science disciplines to address the following needs. 1. Clarify terminologies, scope, and relevance of complementary, alternative, and integrative medicine. 2. Provide direction to designing and implementing integrative medicine research. 3. Illustrate case studies and best practices in this space considering the current health situation in the world. 4. Highlight relevance of appropriate communication and knowledge translation in the space of integrative medicine research. 5. Outline ideas to trigger integrative medicine research within the universities and institutions. Brief standard definitions, scope, relevance of complementary, alternative, and integrative medicine. How to design and implement integrative medicine research. Emerging priorities and best practices in integrative medicine research. Communicating or translating knowledge of research in this space. Outline ideas to trigger IMR within universities and institutions. CO and 3XTUARIZE. A key hurdle to the fulfillment of the sustainable health and well-being is the lack of synergistic and holistic approach to patient care. Efforts are divided between the health and well-being dimensions, between the objective and subjective verticals, thereby depriving opportunities to understand synergistic effects of interventions that address both. For X, growing body of knowledge in meditation and yoga research is indicating physiological improvements in functioning of several body systems, circulatory, cardiovascular, neuroendocrinal, etc., in addition to improvements in well-being and quality of life. Modern medicine has established evidence in optimizing clinical effects for several disease conditions. How can they be integrated for enhancing patient outcomes comprehensively? Non-communicable diseases are a growing concern today. How does modern medicine, Ayurveda, and the other AYUSH practices come together to mitigate the problem? Where do we begin and how do we proceed in planning integrative medicine research to derive benefits at individual and population level? Ayurveda is an age-old school of healing and offers curative and preventative remedies to many conditions that are prevalent today. What are some of the case studies and success stories in Ayurveda research that offers lessons for building integrative research agenda today? These are some questions that provide a context and build the content for the subsequent sections of the chapter. Describe. This section will shed light on key terminologies commonly used in this space. Further, it alludes to practical considerations in designing and conduct integrative research, and some sensitivities involved in science communication and knowledge translation in this domain. The section lists few ideas and suggestions for universities and institutions to initiate IMR in the context of National Education Policy 2020. Toward the end, few case studies and success stories of Ayurveda research are provided as relevant examples of IMR in today's scenario. Definitions and terminologies. Complementary medicine refers to a context where non-mainstream medicine is practiced along with mainstream medicine, alternate medicine, where non-mainstream medicine substitutes mainstream medicine, whereas integrative medicine refers to a systematic and scientific integration of the two to achieve best possible outcomes in health and well-being for its clients. In the same line, The authors use the term integrative health research to extrapolate the idea to the health of the populations with adequate focus on prevention and health promotion. This is particularly relevant today as the research is highly skewed toward curative research without necessarily addressing the lifestyle, prevention, and health promotion aspects related to both communicable and non-communicable diseases. Multidisciplinary scope and ecosystem preparedness. Integrative health or integrative medicine research calls for a systems level effort with a focus on holistic or wholesome care of not just the patients, but their families as well. Working as a team with the common goal of highest outcomes for clients is the focus here, and the outcomes are not limited to clinical cure or relief of symptoms, but also accommodates aspects of well-being and quality of life, particularly in basic sciences. Some work in this direction is already going on and outcomes are awaited with bated breath. For instance, the ASIIA Science Initiative in Ayurveda miscommunication is the leading cause of patient harm and is associated with reduced patient satisfaction, health literacy, treatment compliance, and quality of life. In conventional healthcare settings, the differences in professional hierarchy, training, communication styles, and culture are recognized communication barriers. Less is known about interprofessional communication (IPC). Hospital administration and systems must promote conducive working atmosphere for specialists from different backgrounds. The care should extend to families and community that the hospital caters to. Essentially, it requires a multidisciplinary approach involving clinicians and specialists from modern medicine and a YUSH backgrounds, nursing and physiotherapy, public health, counseling, wellness and well-being, hospital administration, etc. Indian Council of Medical Research in its strategic plan and Agenda 2030 document gives impetus to strengthening infrastructure and interdisciplinary research capacities in this space through a network of centers. Collaborations with YUSH agencies and guideline formulation and carrying out integrative medicine research. Vision, orientation, and capacity building. A high-level vision and commitment from the hospital and health authorities to generate best possible outcomes for their clients, families, and society through multidisciplinary and integrative approaches is the starting point. Conscious effort toward orientation and training of teams in undertaking multidisciplinary research, regular multidisciplinary research meetings and journal clubs, conferences, and seminars will go a long way in building competencies and in opening the mindsets and appropriate attitudes required in this space. In hospital settings during postgraduate clinical training, PG dissertations and collaborative research between modern and YUSH postgraduates may be encouraged. In addition, integrative medicine fellowships, electives, and workshops on integrative medicine research are ways and means of expanding capacities in this domain. Several of these best practices are already in vogue in the West, and it is time these are stepped up within the country, which has been a home to many traditional systems of medicine and healing. Integrative medicine health incubators within the universities and institutions can be yet another platform to trigger momentum and interest in young minds. Designing, conducting, and communicating IMR examples and practical considerations. The research methods can vary from simple exploration and observational studies to experimental designs. Mixed methods study design integrating quantitative and qualitative approaches have been adopted commonly, which generates rich information from multiple perspectives, 80 of which met criteria for applying the quality appraisal tool. The most popular formal mixed methods design was triangulation, used by 74% of studies. The study objectives and the available funding will inform the scope and rigor of the research design. While planning research studies, due consideration should be given to available evidence, and efforts should be made to build on the existing knowledge base. All clinical studies should be registered at the Clinical Trials Registry of Government of India prior to the commencement of data collection. A good beginning for aspirants can be to integrate non-pharmacological interventions advocated by the traditional disciplines with current evidence-based management of diabetes mellitus or hypertension. Ayurveda has specific recommendations on diets and lifestyle modification which are not researched adequately and their effects on lifestyle modification and thereby disease control will be worthwhile to explore. Monitoring the blood glucose and blood pressure levels before and after the integration can give good indication of effects of these interventions. In the context of pre-hypertension and pre-diabetes, where the mainstream recommendations are completely non-pharmacological and lifestyle-oriented, experimental trials may be adopted to delineate the actual impact of traditional interventions. A randomized controlled trial can establish additional incremental effects of yoga and medication on the control of blood glucose and blood pressure in comparison to the subjects that are exposed only to the routine management and lifestyle modification. But without yoga and meditation, in addition to the clinical outcomes, we can also study the impact on subjective well-being and quality of life. Studies do indicate their positive impact on management of stress and anxiety and promotion of healthy behaviors, which are very relevant in chronic medical conditions in India, were randomized to practicing yoga and deep relaxation or standard prenatal exercises 1 hour daily. The results for the 45 participants per group who completed the study were evaluated by repeated measures analysis of variance. And results: perceived stress decreased by 31.57% in the yoga group and increased by 6.60% in the control group, p equals 0.001. In settings where current modalities of treatment are not effective, or in case of new challenges, exploration of alternative remedies such as AYUSH should be boldly explored with due attention to the rigor of scientific exploration. Case series or case reports can precede experimental studies. In terminal cases of cancers where the clients and families go through high distress with substantial loss of quality of life, more open exploration of integrative medicine to mitigate the suffering can be explored. Health systems research and public health research are yet another area with wide scope and ramifications for population health and well-being. In India, health and wellness centers are emerging as platforms at primary care level to improve disease prevention and health promotion efforts. Several pilots have been attempted to integrate yoga and medication at these centers to improve population control of non-communicable diseases and to promote healthy lifestyles. Large-scale research programs, while measuring population-based outcomes, will go a long way in adding new knowledge in this space. While the traditional disciplines are required to be researched adequately, due considerations should be given to scenarios that are not compatible to a particular research design or a method for philosophical and discipline-specific reasons. For example, Ayurveda and yoga disciplines rely on the subjective component of individuals such as body-mind constitution as well as the role of mind in disease causation. These theories of causation are non-linear and complex and pose a challenge for research through the lens of modern science that rely on biological markers at a physical and physiological level. Experts suggest that the research methods in integrative space should be flexible and customized to support the theories and objectives of the discipline, a unique passive form of meditation. We carried out a pilot study recruiting male heartfulness meditators proficient N equals 24 with 28 years of meditation experience. Novice N equals 24, 5 to 16 months of experience. These issues should be overcome through consultations and dialogue between the researchers and clinicians of different disciplines, paving way for newer advances in research methods as well. The role of clear communication to the clients, their informed consent with regards to research participation. Appropriate approvals from Institutional Ethics Review Board are critical in effective conduct of high-quality IMR. Systematic planning of data gathering and transparency in making the data available for public consumption and validation by other experts will go a long way in building credibility of IMR. Communication and dissemination of research findings, both positive and negative, through high-impact peer-reviewed journals. Joint conferences targeting clinicians of modern and traditional disciplines. Multidisciplinary health researchers, policy makers will help to advance research in this space further. Policy makers, health systems, and local hospital systems should come forward with dedicated investment to support IMR in an uninterrupted and ongoing manner. Education and science communication of integrative medicine research, perspectives and considerations. Education plays a vital role in laying the foundation for shaping minds for responsible actions. The progress made by utilizing the advancements in science and technology has solved several problems humanity is facing and will continue to solve many in future. Ancient Indian knowledge system had the wisdom to take care of physical, mental, social, emotional, and spiritual well-being. There is a need to bring awareness about ancient Indian knowledge systems, communicate the essence in a language that is simple and impactful that paves way for integration. Particularly, the communication should be targeted to the medical education systems and clinical practitioners to dispel the myths and concerns and equip them to deal with the current needs constructively. The requirement is to look for easily adoptable and large-scale implementable nuggets of ancient Indian knowledge systems, be it yoga or meditative and spiritual practices. With the Industrial Revolution, the whole world, including India, embraced urbanization and focused on Western methods of education and medicine. The ancient systems and institutions providing education and health became weaker. The world has seen many epidemics and pandemics like Zika, Ebola, H1N1, AIDS, Asian flu, Spanish flu, polio, etc. For a few, solutions were found and got contained or almost eradicated. The impact of COVID and its long-term consequences on people's health is yet to be understood. While vaccines could be introduced, not much progress is made in terms of finding drugs for a cure for the affected. Some combination drugs finding a cure, though not 100% effective, are giving relief to the affected. A glimmer of hope is the anti-COVID-19 drug 2-deoxy-D-glucose developed by DRDO, India. Initial trials have indicated that the molecule used in the drug helps COVID-affected patients recover faster and their dependency on supplemental oxygen is also reduced. The property of only accumulating in virally infected cells has made this drug unique. The COVID pandemic brings into sharp focus the importance of investing in social policies protecting the most vulnerable. Science must remain open and continue to find solutions, and the scope for integrative medicine research is vast. There are many diseases that humanity is yet to find a cure, posing a challenge to the researchers in the field of medicine. Many people are forced to learn to live with diseases like asthma, hearing loss, diabetes, dengue, rabies, hepatitis B, herpes simplex. Some are life-threatening like HIV, AIDS, leukemia. Some like bipolar disorder and schizophrenia disrupt the life of the patient and family members. Diseases like Parkinson's, dementia, and Alzheimer's are life-limiting and pose a challenge to handle. With life expectancy increasing all over the world and the elderly population increasing, providing care for the elderly has become a challenge. Lifestyle diseases are threatening to cripple the world. The response of individuals is different to different medicines and treatments, paving way for personalized medicine today. Ayurveda always advocated customized and personalized approach, recognizing the uniqueness of each being. Allopathy has its chain of side effects connected with every prescribed medication. Healthcare systems like Ayurveda, Yoga, and naturopathy, Unani, Siddha, and homeopathy have been given impetus in India, realizing the need for reviving the profound knowledge of ancient systems of medicine and ensuring the optimal development and propagation of the AYUSH systems of healthcare. AYUSH systems of medicine focus on changing the human body to respond better and making the entire body-mind system intact. The allopathic system focuses on rigorous measurement of the success of any drug and treatment. It seems ironical and unfair to measure the efficacy of one medicine system in terms of what is established for another system. Well-being is essential, and all the progress of science and technology is toward enhancing the quality of life. Providing affordable and holistic health care is the challenge societies are struggling to achieve. Integrative medicine or health research is the need of the hour, and policies, investments, and infrastructure should be conducive to encourage high-quality research in the years to come to realize the goals of sustainable health and well-being. Role of health science universities and institutions in the context of NEP 2020. National Education Policy 2020 provides impetus to universities and higher educational institutions in the direction of multidisciplinary research and education. Here is a list of suggestions to initiate IMR within the institutions and universities. Create stewardship for integrative medicine, multidisciplinary research at institutional level. Create integrative medicine incubation centers to promote innovations and multidisciplinary research. Develop electives, certificate courses, and fellowship programs in integrative or complementary and alternative medicine. Initiate doctoral programs in integrative medicine. Support cross-disciplinary PG dissertation projects supported by institutional seed funding. Case studies in Ayurveda research. Ayurveda can be integrated in different ways for achieving better patient outcomes in integrative medicine practice. Ayurveda therapies and medication, when used concomitantly with Western medicine, help reduce the dependence on the Western medicine, many of which are associated with severe side effects when used long term. They also help to enhance the effectiveness of other medicine or therapies. In this section, we briefly discussed few case studies wherein integrating two or more systems of medicine has profoundly benefited patients with chronic illnesses. It has also given evidence regarding safety such a combination. Ulcerative colitis, a chronic debilitating inflammatory bowel disease, is usually managed with anti-inflammatories, corticosteroids, biologicals, and surgery in severe cases. These treatments are associated with side effects including treatment resistance and risk of malignancies and other organ damage. Oral administration of extract of Halarin antidysenteric, decoction of Ficus glomerata, powder combination of Cyperus rotundus, mesothelium, and Simplecostoris moser, and rectocolonic administration of 100 milliliters Ficus glomerata decoction significantly reduced the symptoms of ulcerative colitis, including frequency of bowel movements, bleeding in stools, and abdominal pain. Hemoglobin increased, erythrocyte sedimentation rate decreased, red blood cells, pus cells, and occult blood in stool were reduced. Patients were receiving conventional medication as well. However, by the end of the Ayurveda treatment, intake of aminosalicylates was reduced by 82.86%, corticosteroids gradually by 25%, and finally stopped general debility and with abnormal structural pathology in the descending colon, particularly sigmoid colon. In modern medical science, there is no permanent curative and safe treatment for this disease. This study can be helpful for reducing the need of steroids and surgical processes in the ascents of ulcerative colitis. A clinical study of 43 patients of ulcerative colitis has been conducted at the OPD outdoor patient department. Osteopenia is a precursor to osteoporosis and fractures and is very prevalent in women around and beyond menopause. Management with hormone replacement therapy, selective estrogen receptive modulators, and bisphosphonates are effective but associated with side effects. A traditional Ayurvedic preparation, conjunctivitis given along with calcium and vitamin D3 supplements for 1 year significantly improve bone mineral density and bone-specific biomarkers, namely serum vitamin D3, osteocalcin, and TRAP5B when compared with calcium and vitamin D3 supplements alone. The Ayurvedic formulation contains plants such as Azadirachta indica, Trichosans dioica, Solanum xanthicarpum, Chinospora cordifolia, and Heterida vasica. These herbs are katu and chitta in taste that are helpful in slowing down the degeneration processes. The herbs are processed in ghee and administered with milk or adding to its therapeutic effectiveness. The bone stabilizing effects of the formulation reduce the risk of major osteoporotic fractures and improve the quality of life scores. Integrative management is the need of the hour in cancer care. Ayurveda is routinely sought after for minimizing the side effects of cancer chemo and radiotherapy and also for prevention of recurrence. A study comparing the effect of adjuvant Ayurveda treatment started during and after chemotherapy has shown promising results in reducing CT-induced toxicity and improving quality of life. Ayurveda herbo-mineral preparations Mopticupta cambida, Mopticupta preval panchimruta, and Suvanab as Mary formulation were administered along with 6 cycles of CT. The CT drugs were based on the type of malignancy. One group received only the CT and the second group received Ayurveda preparations, with subgroups receiving MKD and MPP along with CT. MKD and MPP after CT and MKD, MPP and SBD after CT. It was observed that all the Ayurveda subgroup patients had significantly reduced nausea, loss of appetite, constipation, and fatigue. There was significant improvement in the Karnofsky score for assessment of general well-being and activities of daily life, and global score of the quality of living questionnaire, which incorporates symptomatic criteria, general condition, functional ability, and disease-related symptoms. Recently, a nano-Ayurvedic medicine, a proprietary combination of gold nanoparticles and phytochemicals from mango, was piloted as an adjuvant to CT in a small group of 6 breast carcinoma patients. All the patients treated with the Ayurveda adjuvant showed 100% disease control rate or clinical benefit rate herein. Full details. Pain and the need for use of analgesics reduced considerably by administration of solid lipid Boswellia serrata particles and standardized Boswellia serrata gum extract in knee osteoarthritis. SLBSP was superior to BSE. Ayurveda medications given alone and in combination with methotrexate had similar benefits in rheumatoid arthritis patients. This study is of high importance as for the very first time CAM has been compared with allopathic medicine with all the trappings of a placebo-controlled, double-blind, randomized trial. Placebos were developed to mimic the 148 Ayurveda formulations used in the study. The physician was allowed to draw from this list of 148 formulations to individualize the treatment in the Ayurveda group methotrexate MTX, a comprehensive Ayurveda regimen consisting of calorically unrestricted Ayurvedic diet, yoga, meditation, breathing, and Ayurvedic herbs significantly improved arterial pulse wave velocity, reduced BMI, total cholesterol, LDL cholesterol, and triglycerides, and reduced or eliminated the need for antihypertensive medications in a majority of coronary heart disease patients. 5 to 10 sessions of Abhyanga with Ayurveda oils significantly reduced the need to use antispastic drugs, helped achieve standing with minimal assistance sooner, and gave better locomotion at discharge to stroke patients when given in conjunction with physiotherapy. The modified Ashworth score improves, supporting the hypothesis that interneuron overactivity was impacted by the Abhyanga. Summarize: integrative medicine research refers to a systematic and scientific integration of the modern and traditional medicine to achieve best possible outcomes of health and well-being. IMR effectively integrates subjective with the objective dimensions of health and well-being and can significantly impact quality of life. This is particularly relevant in today's scenario where improvements in longevity of life is associated with changing disease profile and poor quality of life in chronic disease conditions. Successful conduct of IMR requires conducive ecosystem, vision, and funding coming together of multidisciplinary experts across modern medicine, AYUSH, nursing, counseling, public health, technology, and hospital administration. Research methods can vary from simple exploration to observational studies to experimental trials as well as health systems research, with due consideration to building on the existing evidence available. Often the research methods and instruments in one discipline may not be applicable to other disciplines, which should be duly considered. The sole purpose of IMR is to advance health, well-being, and quality of life that should promote advances in integrative medicine as well as research methods. Appropriate attention to ethical aspects, consent procedures while conducting research, and appropriate dissemination with a focus on clinical practitioners from multiple disciplines. Policy makers and health systems will go a long way in building credibility of IMR. It is critical to focus on the young minds and shape their attitudes and perspectives toward IMR through appropriate institutional level policies. ecosystem preparedness, and capacity building programs. Fellowships in complementary and alternative medicine and IMR electives and workshops. Cross-disciplinary PG dissertations and PhD programs. Integrative Medicine Health Incubators will go a long way. Evaluate what do you understand of the terms complementary medicine, alternative medicine, and integrative medicine. What are the key obstacles for effective implementation of integrative medicine research? What are different types of integrative medicine research one can undertake? What hospital systems and larger policy and health systems preparedness will facilitate integrative medicine research? What are some low-hanging fruits to begin integrative medicine research? Where do you think you can start in your setting? Who is a strong collaborator with whom you can take up a research work in your area of work? What aspects of science communication need special consideration when it comes to general public and health policy makers?